people are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
The reality is the Affordable Care Act is no longer affordable to increasing numbers of people.
So first it was former President Bill Clinton calling it crazy. Now more Democrats are piling on, including Minnesota Governor Mark Dayton, saying Obamacare is a total disaster.
So who is the best candidate to fix it? Hillary Clinton or Donald Trump? Here to weigh in, Democratic strategist Chuck Rocha and Kristen Tate from thelibertarianchick.com. Thank you for joining us this morning.
Morning.
Thank you.
So to begin, let's pull this up very quickly. First, let's take a look at Donald Trump's plan. And his plan, bottom line, you can see the details there. It is to repeal Obamacare. And then you take a look at Clinton's plan, and she wants to expand the Affordable Care Act, amongst some other things. So I will begin with you, Kristen. Which is the better fix?
Well, we need to privatize the system like Trump wants to, but it looks at this point like Hillary's going to win in November, possibly by a landslide. And if she gets a Democrat-controlled Congress, we're going to see a push towards, as you're saying, a single-payer, government-paid system. It'll be a lot like Medicaid, kind of like the systems we see in Europe or Canada. And while, health care will be less expensive for the patient, the taxpayers are going to get a massive bill funded by more debt. And in the end, you have quality decrease and costs go up, and access to benefits becomes tougher because of supply and demand. And you could have wait times for things like heart transplants for 3-4 years like you see in Canada.
It's so interesting, Chuck. First, you have President Bill Clinton saying this is the craziest thing in the world, and this is now falling on these small businesses. And now you have a Democratic governor saying, the impact that it's had on my own state is not a good one. If it weren't for other headlines, this is what we would be talking about right now. This is what the voters are caring about.
And you're exactly right. And to remind everybody who's listening, if you want to change a bill, you got to go to Congress. You got to get Congress to vote for a bill. We're probably not going to see single payer anytime soon because there's going to be a Republican House and there's going to be at least 60 votes in the Senate. But what you do need to do is fix it and have little quirks to it, because 30 million new people have health care, and it has great things in it like pre-existing conditions, if your kid's 26 to stay on. But if you're a small businessman like me and you don't qualify for the subsidies, yes, my health care's went up, and the benefits aren't as good as they were when it first started, and that's the problem.
Right? Because you own a small business.
I do own a small business, and when Obamacare started, I was saving $100 a month on my insurance. Now, 3, 4, 5, 6 years later, I'm paying $150 more a month, so my premiums have gone up, right? So that's the problem.
Well, so Chuck, who is it good for then?
They're both going to say that they want to play around the edges, but politically what you said in the beginning is the most brilliant thing. We could be talking about this right now, we could be talking about WikiLeaks, but instead we're talking about whatever Donald Trump might have said or not said last night, and that's the problem. I run political campaigns, and you're supposed to pay on your message, and there's a lot of fodder out there that he could take advantage of, but just not time.
Kristen, the Fox News polls, some new ones came out last night, and when it said, we asked this question, what should happen to the health care law? Now 49% of people say that you should repeal the law. Compare that to December 2014 when 58% said repeal the law. So how do you explain those numbers?
Well, look, it's still very unpopular, and you're seeing, like you were talking about before, Bill Clinton and other Democrats coming out and saying this is not working. They have to, because Americans realize this, and to not admit that is political suicide. Hillary Clinton is in a very tricky position right now because she can't turn her back on Obama. She needs to be loyal to him, but at the same time, she needs to admit in some way that Obamacare isn't working. And I also want to bring up the fact that Hillary Clinton in the past has said that she wants to expand Obamacare to illegal immigrants. If she does that, we're going to see the system get a lot more expensive and unstable.
And never really a full explanation as to how you're going to pay for it. So maybe we'll hit on that in the next debate.
I wouldn't even talk about President Obama's legacy, which is a whole nother conversation. Thanks to you both for getting up so early this morning.
Thank you.
Thank you, Chuck. Thanks, Kristen.